Good morning. It's great to have you here. I'm Michael Dewald, Washington State University's Vice President of Health Sciences and Chancellor of the Spokane campus. We're here today to celebrate the anticipated opening of a Veterans Affairs outpatient clinic right here in the Spokane Teaching Health Clinic. So how'd we get here? Well, partners, many of the leaders here today, thank you for joining us. And thanks for those who are live streaming. We appreciate you being part of this too. Partnerships and collaboration. That is in fact how we're here. The Veterans Affairs and the leadership of the VA locally, but also federally, is why we're here. I'd like to take a moment to talk about what this means. Opening this new clinic means expanded care for our veterans, 2 PAC teams, patient-aligned care teams that will serve our veterans. But it means a lot more. What it also means is expanded education for our residents, for our medical students, for our nursing learners, for our pharmacy learners. We're excited about those opportunities. In addition, this means an expansion of our research opportunities, research that will help us understand disease and intervene. We're very excited about the opportunities that provides. I'd like to take a minute and acknowledge some of the people who are involved in bringing this to fruition. First, at the federal level, Secretary Wilkie, we thank you. Congresswoman Kathy McMorris Rogers, Senator Murray. We also want to acknowledge Senator Cantwell's interest in investment in Spokane. More on a local level, we're excited by the support from our city, former Mayor David Condon, who is here today, Mayor Nadine Woodward. We're very pleased at your undying support of veterans and their care, and the opportunity to work together as a team, Washington State University and the Veterans Affairs, to expand patient care. I'd also like to take this opportunity to express my heartfelt gratitude for Dr. Robert Fisher and Dr. Kimberly Morris, 2 amazing leaders with Mann Grandstaff who do a great job there, but add a vision for expanding veteran patient care, and to bring it here to the University District to provide opportunities for their providers to work with Washington State University and other universities here locally. So without further ado, I would like to bring forward Washington State University's President Kirk Schultz to say a few more words. But to all those who have joined us, thank you. This is a momentous time, and we appreciate you being here. President Schultz.
Well, good morning, and thank everybody for coming. I've been in Eastern Washington long enough now that when you see the rain start falling, you worry about the wheat farmers getting all excited today while they're trying to harvest. So we're really excited about the partnership with Mann Grandstaff, VA Medical Center, and U.S. Veterans Affairs. My father-in-law and my uncle both served our country in Vietnam and are regular visitors to the VA in Richmond, Virginia. And so we have a personal family connection, and I really appreciate the opportunity for WSU to partner with the VA moving forward as we build out what Vice President Dewald is talking about as WSU Health. It's pharmacy, nursing, medicine, population health, bringing all that together with a core underlying theme of really serving the underserved in our state and our region. And that's both in rural and in urban areas. We want to also continue to build out our presence and build out Spokane as not just a regional, but a national center for human health, medicine, where people from multiple states and regions come to this area. And I think that's the vision that was laid out in Spokane through the last several mayors and President Elson Floyd and others, that this is what we wanted to see grow here. And I think it's exciting to take that next step. Daryl mentioned several times partnerships. We're not going to be able to do this alone. WSU cannot do it by ourselves. It's going to be partnerships with other academic institutions, Whitworth, Gonzaga, University of Washington, Eastern Washington University. It's going to be partnerships with the VA, partnerships with our other healthcare providers in this area and region. And I think if we could transport ourselves 10 years into the future and come back, we're going to see this major healthcare research teaching hub and think, wow, look at where we were just a few decades ago and where we are today. So I also want to express my appreciation for several of the folks here. First, Daryl as our Vice President for Health Sciences, our first ever Vice President for Health Sciences. Daryl came on board to build these partnerships, pull our colleges here to work together to really optimize education around patient care and help build this out. And he's done a fantastic job, and very appreciative, Daryl, of your leadership. He couldn't be here today, but our founding Dean of Medicine, John Tom Kowiak, is an incredible, innovative leader and done a great job. And then finally, I'm beginning my 5th year as WSU president, and the entire time, Kathy McMorris Rogers has really been pushing for partnerships and for us to grow here, particularly with the VA. So Kathy, today I just want to express my appreciation for your leadership, for continuing to be persistent, for urging us to continue to be persistent and to see where we are today. And I appreciate all you do for WSU, our region, and Eastern Washington. So with that, pleasure to be here. Look forward to hearing the rest of our speakers, and we're going to continue to build in this area and region, and WSU Health is going to be a key proponent of what gets us there. So thanks, and always go Cougs. Thank you. Tracy?
Well, good morning. It is such an honor to be here this morning among so many distinguished guests to celebrate the VA's new clinic space in the Spokane Teaching Health Center. My name is Tracy Couture, and I serve as the executive director here. Over 6 years ago, the STHC formed as a collaboration with Empire Health Foundation, Washington State University, and Providence Healthcare, with a mission of bringing more primary care physicians to this community through additional residency slots. Just 4 years ago, the family medicine, internal medicine, and psychiatry residencies moved into this building you see behind me. The vision of those who worked on operationalizing this clinic was a place where future healthcare professionals across all fields train and learn from each other. And as we continue to think about the future of healthcare delivery and interprofessional care, I am pleased that the Spokane VA and their patients are a part of this. Solving the healthcare workforce shortage is not something any one of us can tackle alone. And each of the organizations in this community, from those who provide the education to those who hire healthcare professionals, all play an important role. The VA can and should be a part of this solution. It is no secret that Eastern Washington needs more primary care physicians, and I am so pleased that our medical students, residents, and faculty will have a unique opportunity to collaborate with VA physicians and staff right here at our clinic. Together, we will recruit the best physicians for this community and patients we serve. To Dr. Fisher and Dr. Morris, and the physicians and staff at the VA, I extend a very warm welcome to you all on behalf of the staff at the STHC and the Board of Directors. We are so pleased to have you join us. And now, I have the honor to introduce our next speaker, a woman that I am grateful to have as Eastern Washington's advocate in Congress. I've seen firsthand how veterans and military families are always top of mind for her. In addition, as a senior member on the Energy and Commerce Committee, she's led in historic ways to support teaching health centers and improve access to care in our communities. Please join me in welcoming our Congresswoman, Kathy McMorris Rogers.
Good morning, everyone. It's really great to be here, and as you know, both Tracy and David Condon are former team members of my team, served on Team CMR as district director, so it's especially fun to be with them. And to the leadership of WSU, Dr. Kurt Schultz and Dr. Dewald, as well as the leadership at the VA, Dr. Fisher, Dr. Morris, and just thank you everyone for being here. This is a tremendous partnership with the mayor, the leadership of this community coming together. This is a great celebration, and it's a reminder of what we can achieve when we dream together, come together, and then work hard to make it happen. You know, a number of years ago, I was setting goals as far as my team and the work that we wanted to do to improve veterans care in Eastern Washington. And at the top of the list was supporting this partnership between Spokane's Teaching Health Center and the Mann Grandstaff VA Medical Center. This is a win-win to bring more doctors to our region, which we need, and to ensure our veterans have better and timely access to care. And that's why I have led to double the funding, extend the Teaching Health Center program, and increase the number of graduate medical education slots. Right now on the Energy and Commerce Committee, I'm leading on a 4-year reauthorization for THCs. It is a proven and effective way to bring more primary care doctors, mental health providers, and other providers that we need here as well as across the country. Because doctors, as we all know, are more likely to stay where they practice, where they do their residency. They're more likely to stay and practice where they do their residency. We've embraced this strategy in Spokane, and I'm proud that the Teaching Health Clinic has become a national leader in recruiting the next generation of healthcare leaders. Now, because of this partnership, we're making sure that these top-notch doctors train with the VA and are equipped to provide the best care possible to the men and women who have served in our military. To make the case for this, I've invited and been able to host the Secretary of the VA, Secretary Wilkie in Eastern Washington, as well as the chairman of the House Veterans Affairs Committee, Phil Rowe. As I told them, we're going to be the model for the rest of the country to follow. We are leading in an innovative way to ensure that the red carpet is rolled out for our veterans so they get the care that they have earned after they have served. So thank you to everyone who's working together for Spokane to shine. This gives me hope. It's the very best of our community coming together to improve people's lives. And it's needed more today than ever. So thank you. And I am proud to introduce to you our exceptional mayor, Nadine Woodward, who is leading during a very difficult time and doing it in an exceptional way to bring hope and healing to our community. Mayor Nadine.
Thank you, Congresswoman McMorris-Rogers. Today is a great day for the city of Spokane and for the health of our community. Back in 2016, the past administration under David Condon had started on a course to build a safer and healthier community. The groundwork of partnerships and targeted investment in the university district that sprung from that priority has helped shape our community today. I am proud to continue supporting that goal, to continue supporting the innovation and the commitment of our medical health institutions to help build a stronger community. 2020 has brought some incredible challenges to our city, and I am sure there will be even more before this year ends. But Spokane has shown how resilient and passionate we are in supporting one another. We are at our best when we work together. And today we are able to celebrate the confluence of compassion and innovation, the culmination of the desire to better support and care for the veterans of our community, and allow future healthcare professionals the opportunity to train alongside these experts. I want to thank WSU Health Services, the Spokane Teaching Health Center, and the VA for partnering together to bring the outpatient clinic to Spokane. And I want to thank Congresswoman McMorris-Rogers and, of course, David for being here today to support our veterans. When we all work together, we are a stronger community. Thank you.
Good morning. I'm Dr. Matt Leighton. I'm the Associate Dean of Clinical Education for the Spokane Clinical Campus, and I'd like to add my greetings and congratulations. I have a couple of reasons why I'm particularly excited about this today. One, I moved to Spokane in 1999 and have been working with staff at the Mann Grandstaff VA Medical Center since 2000 to help expand medical education, both at the graduate and undergraduate medical education levels. The other reason is because I served on the board of the Empire Health Foundation for 9 years. I was fortunate to get to chair that board for 2 years at a time when we worked together with Providence and with WSU to establish the Spokane Teaching Health Center. With this, we are bringing a partnership to campus that will help us take this to the next level. Undergraduate medical education, graduate medical education, and as President Schultz said, our founding dean, Tom Koviak, was not able to make it this morning. I'm here representing him and his vision, and I want to thank you for being here this morning. I want to wish you well, and it's my pleasure to introduce from Mann Grandstaff VA Medical Center, Dr. Fisher.
If I keep my glasses on, I fog up when I have the mask, so I have to coordinate when it comes off and the glasses go on. So good morning, everyone. I am Dr. Robert Fisher and the director of the Mann Grandstaff VA Medical Center. I am delighted to be here with you today. Before I make a few remarks and introduce our next speaker, please allow me to thank each of you for making this milestone event possible, especially all of our academic partners supporting health sciences in our community. Today is confirmation of the goodwill of our region's leadership and the higher education institutions, particularly the medical and health science departments, who share a common interest in working with VA to expand opportunities for health professional students committed to becoming the physicians and nurses of our nation and region's healthcare industry desperately needs. For VA and my team at Mann Grandstaff, we look forward to teaching and training students in this beautiful downtown facility. We are also eager to have several of our skilled providers rotate through the Spokane Teaching Health Center to enable more access to care for veterans. We'll do so by deploying PACT, our patient-aligned care teams, who in addition to teaching, will also offer primary care to veterans inside the teaching center. We look forward to an enduring partnership built on trust, commitment, and compassion for delivering quality health care and ensuring these professional health students are inspired about the exciting career ahead of them. I want to specifically thank Dr. Michael Dewald, Vice President and Chancellor of WSU, for his vision and innovation that fostered our academic partnership, and to Dr. Kim Morris, the spark and our catalyst and rainmaker for all things related to medical education on our campus. Many thanks to Brian Henneman and his engineering team for forging the affiliation with WSU and our academic community in record time. Sincere thanks to our local and regional members of Congress, Kathy, for their persistent and unflagging support of this initiative and the expansion of medical education opportunities for health professionals in Eastern Washington. Margaret Holt, where are you, Margaret? Thank you so much for all your work putting this event together. Thank you very much, Margaret. Now I would like to introduce Dr. Kim Morris, our Designated Education Officer and our Chief of Geriatrics, Rehabilitation, and Extended Care at Mann Grandstaff. Thanks, everyone.
Thank you.
Thank you, Dr. Fisher, for such kind words, and thank you, everybody. Can I just say this is a really exciting day. I had to add my own little flair. So this collaboration with the VA and WSU and the Spokane Teaching Health Center is a beacon of hope during an uncertain COVID-19 2020. And I have to say, we all are in uncertain times, and we don't know what's ahead of us. And obviously, the landscape of medicine is also changing for the future. We are all wondering what the new normal is going to look like. This venture will help form the new normal for medical care delivery and health profession trainee education, and how it'll look in Spokane. At first glance, this is just a space in a building with 4 walls, but at closer look, it is so much more. For our veterans, they'll have increased access to primary care in a very innovative and collaborative environment. For our academic affiliates and health professional partners, such as pharmacy, behavioral health, social work, nursing, we will be able to collaborate and innovate in teaching through interprofessional teaching models. And for the 140 plus medical students, residents, and health professional trainees, they will be able to learn from our nation's veterans, our country's heroes, and the skilled teaching faculty in our region in an innovative, state-of-the-art environment. And for Spokane and Eastern Washington, it's a collaborative spirit that will be a catalyst for helping train the future physicians and healthcare professionals of our region. Of course, many have been partners in helping this vision come to fruition. And I'd just like to really reach out and thank the Office of Academic Affiliation of the VHA, especially Dr. Karen Sanders and Dr. Martin Eason. They have been instrumental in moving this effort forward. And of course, the OAA leadership, Dr. Bowman, Dr. Bope, and others. Of course, our congressional partners, we couldn't do it without them. And I'd like to give a special shout out to my colleagues at the Mann Grandstaff VA Medical Center, particularly my admin staff, Luke, Michael, Courtney, and Angela. I couldn't do it without them. They've just been an incredible support. And Brian Henneman, our Chief of Engineering, and all the folks in contracting have helped to expedite this, which is amazing. And of course, my partners in crime, Drs. Fisher and Dewald. I have no words about working with you guys. It's just been a complete honor for me. And, to be partners with your vision and our vision has just been a complete honor. Who are these folks up with me? I'd like to introduce one of the 2 new primary care faculty that are going to be located in the space on the 2nd floor of this building in the new VA space here. And the first one is Dr. Brian Yates. He is currently a physician at the Mann Grandstaff VA and has multiple years of experience in teaching and promoting educational efforts. Woohoo! And Dr. Jeremy Graham couldn't be here with us today, but he is another one who has a wealth of experience. He actually was a faculty member at the Providence Internal Medicine residency program, and he will be the other faculty who will be leading this effort and moving this vision into the future. And then John Givens, our nurse anesthetist at the Mann Grandstaff VA. I wanted to bring him up to introduce him because we have also reinvigorated our research program at the Mann Grandstaff VA Medical Center, and he's going to be leading that charge. So we have a lot to celebrate today. And I just can't thank everybody enough who is here today celebrating with us. Thank you. And I think, do I need to introduce? Yes, David Condon, our former mayor. Come on up. Thank you.
Well, it's good to be here, Dr. Morris. I think the last time we were together, we had hatched an idea of 25 new healthcare companies, $50 million in capital raised, $75 million, probably better than that, though, in research, and 100 new residencies. So over 10 years, right? So we're on our path. But I'm here today as a veteran, as someone who spent the beginning of my career in the Army, a member also of the WSU family, as I'm a member of the Chancellor's Advisory Committee, and also somebody who works in healthcare now. It was some 8,879 days ago, May 10th, 1996, that I raised my right hand and swore to our nation to always put mission first, people always. So it is in that light, as a veteran, that I begin my comments. Mission first, people always. This morning, we do the same by putting the missions and visions of two organizations first, by thinking about and caring for the people always. The mission and visions, in part, of the Veterans Administration and the WSU Health Sciences campus here in Spokane are, for the VA, to fulfill President Lincoln's promise to care for those who shall have borne the battle by serving and honoring the men and women who are Americans' veterans. And in part, the mission and vision of WSU Health Sciences Spokane is an entrepreneurial health sciences campus where world-class scholars and healthcare practitioners, students, and community partners collaborate in teams to teach, learn, and design and make discoveries to lead measurable, healthier people and communities. So as both of these two organizations are focused on people always, by serving and honoring the men and women that borne the battle, and that they do this, as WSU's vision says, by being community partners in their collaboration. Today, veterans do win. They have access where they are in our community to world-class healthcare in a community-based teaching center. But missions and visions are often just statements. They sit on a shelf or are framed on the wall. It is about people that fulfill them. Today, many of the people that have made this happen and continue to lead in this area have spoken, but there are so many others. The caregivers and, of course, the veterans who will call this their medical home. So it is with two large institutions that I say thank you and that you dared to take on the bureaucracies, that you are here today to make this happen. I will say it was my last public speech on Veterans Day, several months ago. It is also my last thing I did serving on staff in Congress as the renaming of the Mann and Grandstaff Hospital that came to fruition long after I had left. But it was in meeting those two families, the Grandstaff family and the Mann family, that it really showed to me the community that the VA creates, generation upon generation. So these things, these projects that are worth doing, don't just come in one administration or one person's career or the next. There are several careers, several administrations, but it's today that these things come to fruition. So in closing, I want to touch on about today as someone who also works in healthcare. At Primera, our mission is to make healthcare work better. And as the Elson School of Medicine's mission states, and I will say this, it's quite succinct, almost mission-focused, people always. And I remember the day that Dr. Floyd sat in my office and said he was going to start a medical school, and I took a big gulp, and I never thought that day would happen. But their mission to solve problems in challenging healthcare environments across the state of Washington, I couldn't think of a better partnership, a better community-based healthcare clinic that these two organizations come together to care for those who bore in the battle. Thank you.
Darrell DeWald, Kim Morris. It's my pleasure to present this commemorative to be hung in our joint clinic, representing all that we've accomplished, all that you've accomplished in making this a reality. So, in recognition of those efforts, I now provide you with this commemorative. Thank you very, very much.
Thank you, Dr.
Thank
Fisher.
you. Thank you. Woo!